Modern healthcare relies on artificial intelligence to process complex medical imaging and automate disease diagnosis. These systems are physically separated. The diagnostic hardware resides within the hospital, while the heavy AI computation is handled on a remote, centralized server. To generate a diagnosis, the hospital must move a 50 kilobyte X-ray image file from the local hardware to that remote server. This forces highly sensitive patient information across an unsecured public network, where the payload is exposed to interception. Because this data determines precise surgical interventions and acute treatment plans, maintaining the integrity of the pipeline is a technical requirement with immediate clinical consequences. That exposure creates three specific threat vectors. First is eavesdropping, the unauthorized acquisition of patient data while it is in transit. Second is data tampering. If an attacker modifies the binary data of an X-ray, the AI will process an altered diagnostic result. Third is a man-in-the-middle attack. Here, an attacker positions themselves between the hospital and the server to intercept and potentially alter communications between two parties who believe they are connected directly. No single encryption algorithm addresses all three of these vectors while maintaining the performance levels required by medical hardware. The design challenge is to construct a multi-layered pipeline that preserves high-speed data flow without introducing vulnerabilities that could compromise the final diagnosis. The first layer of our design uses the Advanced Encryption Standard, or AES 256. This is a symmetric cipher optimized for large data blocks. Symmetric encryption relies on a single key. As shown in the formula, the algorithm takes the 50 kilobyte X-ray and scrambles the plain text into a secure ciphertext using key K. In benchmarking tests, AES 256 encrypts a 50 kilobyte file in just 0.0000852 seconds. However, symmetric encryption presents a massive problem for network security: the key distribution dilemma. The exact same key used to encrypt the data is required to decrypt it. If the hospital transmits this key over the open network so the AI server can decipher the image, any observer who intercepts that key can access the medical data. AES provides the necessary speed for medical IoT, but on an open network, it cannot function securely without a secondary method to protect the key itself. To solve for key distribution, we introduce a second algorithm, RSA 2048, an asymmetric encryption system. This utilizes a public and private key pair. The public key is shared to encrypt data, but only the mathematically linked private key, held only by the server, can decrypt it. The limitation is capacity. RSA 2048 is restricted to a maximum payload of 256 bytes. Our X-ray is 200 times larger. If the system attempts to encrypt the bulk image using only RSA, the math rejects the operation and transmission fails. But while the X-ray is 50,000 bytes, the AES session key required to decipher it is only 32 bytes long. This creates a hybrid opportunity. RSA cannot protect the medical image directly, but it is the perfect tool for the secure transit of the 32-byte symmetric key. The hybrid process begins with the remote AI server generating its key pair and sharing its public key with the hospital hardware. For each new patient scan, the hospital device generates a temporary 32-byte AES session key. It uses this key to rapidly encrypt the bulk X-ray image. To protect the session key during transit, the hospital applies the AI server's RSA public key. This secures the 32-byte symmetric key. The hospital then consolidates the encrypted X-ray and the wrapped AES key into a single transmission payload and sends it across the network. Upon arrival, the server uses its private RSA key to unwrap the AES session key. It then uses that session key to revert the ciphertext back into the original medical image. This architecture provides both high-speed bulk encryption and secure key distribution, solving the fundamental flaws of both algorithms. To verify this defense, we must test a common vulnerability in simple hybrid systems, the unauthenticated key exchange. While the RSA encryption is computationally infeasible to bypass, the hospital currently has no way to prove that the public key it received actually belongs to the legitimate AI server. In a man-in-the-middle attack, an adversary intercepts the server's public key transmission. They destroy the original and substitute a counterfeit public key, which is then forwarded to the hospital. The hospital hardware unknowingly uses the attacker's key to wrap its AES session key and initiates the transmission. Because the session key was securely encrypted using the attacker's public key, the attacker can now unwrap it. This allows them to decipher the X-ray, modify the image data to inject a diagnostic error, and re-encrypt the file for the server. Flawless execution of RSA and AES cannot prevent this. If the key is spoofed, the attacker has full access to the data, creating a risk of medical misdiagnosis. This necessitates a third layer of the architecture, data integrity verification via SHA-256. Before transmission, the hospital generates an SHA-256 hash, a unique digital fingerprint of the original image data. This calculation takes only 0.000068 seconds. When the server receives the data, even data modified by an attacker, it must independently recalculate the hash of the image it received. The server compares this new hash against the original sent by the hospital. If even a single bit of the X-ray was changed by an attacker, the two strings will not match. Because the man-in-the-middle attacker altered the binary data of the image, the hashes diverge completely. The server now has mathematical proof that the data was tampered with in transit. Having detected the compromise, the server immediately rejects the payload. This prevents a corrupted diagnostic result from reaching the physician. This complete architecture relies on three distinct pillars. AES-256 provides the speed necessary to process large medical files in real time. RSA-2048 establishes a secure channel to distribute symmetric keys across unencrypted space. And SHA-256 serves as the final integrity check, ensuring the data processed by the server is identical to the data captured by the scanner. While hashing detects the presence of tampering, preventing key spoofing entirely requires a public key